Hello, everyone. Welcome back to yet another episode of CIO podcast, where we delve into the transformative power of technology in healthcare. Today's discussion is pertinent for many of us. Rising cancer cases in India is a matter of great concern. According to a recent report, India is fast becoming the cancer capital of the world. As per the estimates of WHO's Cancer Agency, India reported over 14 lakh new cancer cases and over 9 lakh deaths in 2022 alone. Thus, there is a need to consistently improve and innovate in the way cancer treatment and care is provided. Now, the question today that we are asking is, can data transform the way cancer care is delivered? And to discuss this, we have with us today Amit Sharma. Amit is CIO at CyteCare Cancer Hospitals. He is also heading partnerships and CSR at CyteCare. Amit has over 2 decades of rich experience spanning life sciences, healthcare, and IT. In 2017, he was awarded prestigious Chevening Fellowship in Leadership and Management from the University of Oxford by UK Foreign Ministry. But his passion extends beyond the hospital walls. He also collaborates with NGOs and educational institutions to raise cancer awareness and secure funding for treatment. Amit strongly believes in leveraging data to drive impactful change in healthcare. And today we are eager to tap into his expertise as we explore the importance of harnessing data in digital transformation of a cancer care hospital. Welcome, Amit. Welcome to DHL.
Welcome, Aarti, and thanks for this introduction. I'm really humbled, and I thank you for inviting me for this postcard. A very pertinent topic, cancer, as you said, it's spreading far and wide into the society. So I think it's high time we, as a healthcare institution and also as a society, understand the importance of data related to cancer, which can help our future generations in trying to curtail this menace. So happy to talk to you.
Amit, my first question to you is, as we rightly established that cancer cases in India are rising at an alarming rate, and hospitals generate massive amount of crucial data point about patient health. How can we harness this data to revolutionize cancer care? What should be the approach of a cancer care hospital towards data that is being generated in their health system?
So, I mean, just to start the conversation, very recently I was reading one report. So, of the global data, I mean, the entire data that we talk of generated in the entire world, 30 to 35% of data is only healthcare data. So, you can imagine the kind of data which is being generated across the world. But unfortunately, probably only 1 to 2% of that entire data is being kind of put to use in any fruitful form, be it either getting some insights or even sometimes even for using it for the daily transaction, which is helpful to the patients. So a lot of ownership lies on industry, which is the healthcare provider, but also the entire ecosystem where we work with partners, specialists in trying to get some meaningful insights into the data. Now, coming back to your question, how can a hospital like us, a specialized cancer hospital, or any hospital who is treating patients, because cancer treatment is not only uh, only not happening in the cancer hospital. Uh, I think one of the most important aspect is to understand what is an important data which can actually give you a meaningful insight. So, was one of the first step is data inventory and data classification. Inherently, there is a tendency to kind of gather as much data as you can, but too much of any data then causes a lot of problem. One is you're not able to actually analyze the data because you get overwhelmed with so much of data that you have in your system. And now with the DPDP Act coming into the picture, many of the organizations who are relevant or who understands the implication of it, they will be facing consequences in terms of how to safeguard the data, how to ensure that the correct data is stored in a accessible format, in a secured format, and is used for the correct insights. So I think now again dwelling into that topic that how do we use it. One of the important aspect of data is we can use the amount of data collected into the hospital for personalized treatment. There are more than 200 types of cancer. Every individual
Hmm.
is an individual. So there is a lot of scope of personalization on the treatment. I'm not saying everyone will have an individual medicine per se, but there are points, indicators, there are signs, symptoms based on which the entire protocol of cancer treatment is kind of triggered. It is changed during the course of the treatment, and it all depends on how you're collecting data and you are analyzing the data to tweak the change in the treatment of the patient. Then regarding the clinicians, data is an important tool for enhancing their clinical decision making, because till historically the clinicians have been prescribing one medicines or particular medicines, and then they rely on most of the time the global experiences that is evident in the research publications and in the national and international guidelines that how a drug will act. But now, if we are able to actually collect the data and utilize it, it's like just in time sort of a clinical decision making. A hospital like us who has advantage of utilizing the expertise of the so-called super specialists available with us and collecting the data, we use that data in our conversations in tumor boards to kind of tweak the treatment. So decision making is very very quick and adaptive. So it's sometimes we call it as an adaptive clinical treatment. Then monitoring of the patient itself get huge boost when we use data, because if there is a way we can use digitization and technique and we can reach out to the patient without kind of bothering them too much, reducing their travel time, uh, easing their life by providing them access to their own data, then the follow up becomes much easier and it is much more relevant, because when they give up the follow up in their own home settings at their own comfort, most of the time the data quality is better. So, and the last but not the least, I would say probably one of the most important is giving the entire data back up to the research community is I think one of the most important aspect of this entire exercise, because uh, it's something like you use the just in time data to tweak the clinical protocols, the clinical trials which are happening across the globe, and these kind of data then actually helps in I would say making the entire course correction of what is happening in the research industry.
Hmm. So basically, the data should not be kept in a silo. It should be also shared with the research community.
Exactly, exactly. And
It is said.
there are different models, there are different mechanisms, there are different platforms. So a hospital like us who is part of the global clinical trials, by their own mechanism, they are part of that ecosystem where the data is fed back because you are part of the clinical trials. But then there are other mechanisms such as being part of the national and international cancer registries, where you can actually give back into the registries which give you authentic data. So the kind of data that you quoted at the start of the study, that itself is possible because hospital like us and many of the other hospitals, they are giving it back into the national registries.
Well, that's, I think, should be the novel approach towards this. My next question is regarding diagnosis, because one of the main challenge with cancer care treatment is the late diagnosis that happens. How do you see data analytics uh, or data in general improving the diagnostic accuracy and the speed?
So, in screening and diagnosis, I will probably try and club both of them. Say, unfortunately, in the Indian landscape, screening has been uh, a very, very underserved area or a neglected area. So, if we have a very robust screening mechanism, something like the annual checkups, or as per the protocol, so for example, for every woman above 40 should have uh,
Hmm.
a breast screening and a cervical screening program at the prescribed time frame. And these screenings would involve some of those prescribed tests, which can give you an insight, which can give you a data. So, in some scenarios, there is evident from the direct diagnosis or the direct outcomes of those screenings that somebody has a sort of a disease like cancer. And many times when you compare it with your previous year's data and there are changes which gives you some sort of a insight that there is something which is triggering in the body which requires you some additional efforts or maybe some additional follow-ups or a prescribed time frame is also provided. So diagnosis obviously uh, would help in kind of improving the early detection, because if you have a correct diagnosis, uh, many of the cancers are actually curable. So, I mean, there is a myth that cancer relates to death, but I always quote a statement by one of our senior oncologists that people don't realize that cancer is one of the most curable disease. It's just that the timing of the diagnosis if you can make, if you diagnose a breast cancer in stage 1 or the earliest possible stage, 95 to 98% of the time you can cure cancer. But that's not the case with diagnosis or the diseases like hypertension and BP or diabetes, where you carry it or you only manage it.
Hmm.
So I think it all depends on the stage of diagnosis or and the correct diagnosis. So there are data points. Then genomic data is extremely important in the diagnosis. There are different set of genes which, for example, the BRCA genes in case of women cancer like breast cancer and cervical cancer, it helps. So family history, it helps. It plays an important role in the entire protocol of how do you diagnose or how do you screen the patients. Then the data generated from these diagnoses fed into the system, which are now prevalent all across the world, in building smarter systems using artificial intelligence and machine learning. So, I mean, earlier everything was read by people manually. So now you have systems, automated system which can read up films, which can read up data, and which can directly give you insights. So, I mean, radiologically, the speed at which the machines can read and predict that there is something not correct in the scans or in the images or in the data points is huge. So diagnosis, the speed of diagnosis also increased, but for that we need data. Again, coming back to it, and more importantly, the correct data, because as I said to you, only 2% of the data is actually being analyzed. So that's the challenge that we all faces.
Right. Now, there also comes one technical aspect to it, because there is a radiological data coming in. Huge, amount of images are being generated in the system. How do you manage it? How do you ensure that this data is secured and stored?
So, very valid question. As I mentioned to you, now with the regulation coming in, I mean, in globally there has already been regulation like GDPR, and the US acts out there. HIPAA compliances have been there. India obviously has been a little late, but fortunately we do have a very robust act in place, which hopefully will be notified in the next coming months after election. So it is actually passing on the ownership of regulating this data. Uh, and the one important good aspect is it is also giving a lot of control of the patient data to themselves. So they will be stakeholders, important stakeholders, where they will have full control on what is being kind of shared, what is in the public domain, what can be shared, what can be anonymized, what can be used by hospital themselves, what can be used by the research community. And for everything, there has to be a very detailed, informed consent that will come into the place. So that gives the control in terms of the data. The second part, which is how do you ensure that data is safe? There are mechanisms. Fortunately, India is the IT hub of globe, so we are in the right place at the right time. So there are so many specialized data management organizations, all the who's of the ITs. They are ready to help the healthcare organizations in building up secure data practices. You obviously will use all the possible secure measures like securing your own data centers if you are inside the premises, or if you are on the cloud you have to be in the secure cloud. uh, the uh, the data which is secured would be anonymized. uh, they would be encrypted. The access control of the data is itself an important. But I think at the end of the day, a lot of focus would also have to be given by healthcare centers in taking all the stakeholders, training their own staff people, training or giving insights about the data and how it will be used to the patient itself, so that they kind of positively come into the system and try and kind of give consent to use their own data for the benefit of the society and the country. But in terms of security, I'm not that bothered. I think it's a cost. Definitely, it's a cost on the healthcare system, but it's worth the investment.
Absolutely. Amit, could you share some specific instances where data has been pivotal at site care in enhancing treatment effectiveness and patient recovery?
Yeah. So, see, fortunately, we are one of the new hospital who, from day one, have been kind of very, very focused in realizing the potential of the data. So, we were one of the first hospital in India to leverage a concept called as tumor boards. Uh, it's a full-fledged board where 20 to 25 specialists and super specialists sit together and they discuss each and every case in the hospital which comes to the hospital. So the entire medical record, entire diagnostic record, entire radiological records are put into the system. They are put into the multiple screens. The input of those tests are being discussed, and then the treatment protocol is being decided. So no treatment protocol is left to the decision making of a single doctor. There is a clinical board or a medical board which decides. So which itself has resulted in the best possible outcome that we can see, and that we have full faith to believe, and we have data to believe that many times the treatment protocol which has been suggested in some of the subpar centers, and when the patient comes to us for second opinion or for getting the treatment, the protocol has been changed. And this is being possible because we have access to the data and access to the expertise which is available in the data or available from the data. Uh, there are many things. We have been working very closely with research community. So another example of how we are utilizing the data, we are one of the first hospital, or probably the first hospital in India, who actually kind of worked with a drug research company, and we gave them access with proper informed consent of the patient to the cancer cells, the tumor cells, which are taken directly out of the operation theaters. Within 5 minutes, those tissues, the extra tissues, are provided to the lab which is being set up into the hospital, and they are working on some of the novel cancer drugs, and they test the anti-cancer activity of the drugs. So these tissues, they have a life of 15 to 30 minutes. So after 30 minutes, they're of no use. But within 10 minutes, if these tissues reach into the lab, and then the testing is done on those tissues, on those new molecules, the data generated gives so quick insights to those research scientists, which is really helpful, because then you save hundreds and thousands of man hours of culling the data and looking at the global data of how this particular drug could have acted or simulated in an environment. So just to give you an answer that how quickly or how I would say meaningful this association has been, we have been able to provide more than 100 tissue samples to this organization, drug research company, in just about 2 years. Whereas the next hospital where they have been working in US, they have not been able to procure maybe even 5 or 6 samples in that time frame. So obviously the ease of supporting research and providing the correct data, because the data, it's not only the tissue, it's the associated patient history data, patient symptoms data, and the access to the clinicians, which all have resulted in this entire scenario. There's another example where I can mention. We are one of the first hospital to use a concept called a smart ICU, where our ICU is not only manned by foot on the ground, which are the doctors intensivists, but we also have smart systems which are put into the hospital ICUs, where we have high definition cameras and interconnected monitors. So all the feeds from the patient monitors are fed into the systems, and these systems, they take back data into the centralized command center, and the data which is coming out and read instantly uh, from the patients is being used to actually predict how the patient is doing, and is there a possibility that the patient can go south or north, depending on how the data input is. And this input has been really helpful in managing or preventing some of those cases where the patient would have gone into some complications. But the data which is being fed by these systems and read by smart people has helped us in improving the patient outcomes.
Absolutely. But Amit, when you say that there is so much reliance on data now that we are moving from paper-based system to a paperless system, uh, do you see any conflict or challenge in the area of change management within the hospital?
No, absolutely. Say change is imminent. I mean, you have to undergo this, even though it's painful. So, with all due respect, all the senior doctors in the industry who have been doing or practicing in their own way, it's not easy for them because they have been practicing for this like paper based in 30 years. So it's a big change. So convincing them to actually adopt to technology, trying to get everything into the system is not easy. It requires a lot of persuasion, but at the same time clinicians are obviously the smartest people in the organization. So they also understands when you show them the outcomes, and when you show them the power of the data that you collect, and that same data actually fed into the decision making, which I mentioned about the clinical decision making, then they do understand. What they need or require is some sort of a hand-holding assistance. There are smarter ways of doing it. Now you don't have to type everything. There are smarter ways of capturing data. You have kind of tools which is available, which can be used to actually capture the data into the system. And then once you start doing it, the systems also are becoming smarter and smarter. So you can do a lot of machine learning projects which ultimately helps the patients and the clinicians out there. So it's not only applicable to patients, some I mean doctors, sometimes the patients also kind of who have come from traditional backgrounds, so they also feel that a lot of time the doctors is spending time on the systems and not able to talk to them, but then you explain to them how it is helpful to for their own cause and for the cause of the disease, so then they cooperate. And the last thing which I was also mentioning, there is another mechanism of collecting data, which is the patient related outcome measures, the prom. We are one
Right.
of the first few hospitals in India which is delved into that area, where I mean, it's not that once the patient is out of the hospital, is out of sight, and you don't need to connect with them. Rather, we feel that they are the most important stakeholders in the entire value chain, because we need that input, that post the treatment completion, how are they doing? And if they're doing fine, then it helps the community in kind of validating the treatment. And if they're not doing, or if there is something relapse happening, at what time frame, or is there an alarming signal which can predict any possible change or relapse, then it can be recalled early and help in the treatment of the patient. So this entire area becomes a part of the change management. Doctors, the patient services team members, they all have to go through it. But I think the outcome is the driver. Once you are able to show
Hmm.
them the benefit of the outcome of such complex change management processes, things become easy.
Absolutely. Amit, today patients are also becoming smarter. They're using wearable devices which record their sleep timings, their running timing, their exercise, and whatnot. So, health data point is also being recorded at that level. Being a cancer care hospital, how do you ensure that this data is being leveraged to improve sort of early diagnosis, or you can leverage that data to detect whether this patient can develop cancer later on?
Yeah, so that's where I mentioned about the importance of screening, because say one time data is actually, I mean, not many people realize, but a single transaction data in healthcare is virtually of no use. Sometimes it can be misleading also. So you need a longitudinal data across the time. So when you have screening data available for a couple of years, and then you are able to show them the change, that okay,
Hmm.
you had something in the body, and I'm just giving an example, a small lump which is probably a non-malignant in your first screening. In the second screening, probably same, but in the third screening it grew in size and maybe in the character. So to start with, say maybe a manual interpretation, but if you have a smarter system, then obviously you use the system itself alerts the doctor as well as the patient that there is something which is not correct, so take a course of action. uh, we do we are almost 8-year old now, so we have a lot of patients who have been doing their annual health checkups. So as simple as that, a basic system alerts that your health check is due, and importantly, for the family members of the patients who have been part of the cancer treatment. So as you know, some of the cancers, they have genetic predisposition, especially the breast cancers where you have some
Hmm.
genetic history. So I think in those scenarios, it is again even more important to kind of go back and interact with the patient, explain to them the importance of data, and then along with them to try and kind of collaborate with the hospital to get the data back into the system. uh, Currently we are not, I mean, the healthcare system is not that well connected in India, because there is a lot of problem in terms of interoperability of the data points. But there are ways that we can still get some data, and most importantly the data insight from those data, which can help the doctor in kind of raising an alarm, or kind of making patients aware that okay, what is the next step. But an interesting example of what you mentioned, which is I hope and pray that it soon happens in the Indian context, is I was reading, I think there was a study in one of the European countries, where just by the movement, or I would say noting down the steps, number of steps taken by the patient post chemotherapy, has been an indicator of how a patient has been doing post chemotherapy. So the more number of steps taken by the patient in the definite time frame gives a clear indication to the doctor that the patient is coming out of the pain, and it can be even post surgical and chemotherapy. The patient is moving toward normality. Whereas the reduction in the steps, daily steps being taken, is an alarm, where the doctor then immediately goes back to the patient, calls the patient, hey, I've noticed something which is not correct. Post your last follow-up, we have got the data that your the daily steps movement itself is less. uh, they get more symptoms, or input about the symptoms, and then they call back. So this, it's a very simple example, but a very pertinent example of how important these wearable devices can be, even in the space of cancer care.
Absolutely. Amit, one more question. Uh, Post treatment care is very crucial for long term survivorship of cancer survivors. How can data driven insights aid in monitoring and managing these cancer survivors, preventing recurrence and addressing the late effects?
So the example which I gave it to you, I mean, it's one of those
Yeah.
examples, but this was probably just immediately after it. Say cancer patient, I think they need to understand there is a very important aspect, or a metric which is being tracked by all the clinicians across the world, which is the 5-year cancer survival post
Hmm.
treatment. So it's something like, just giving an example, if 5-year treatment survival is 90%, then it shows that that particular cancer and that particular treatment has worked, and 90% of the patient who have taken the treatment, they have survived post 5 years, which is a good indicator, which is a assuring indicator. Then the post 5 year, the chances of their recurrence becomes very very less. Whereas for some cancers, very aggressive cancers, if the post 5 year survival is 10 to 20%, then it obviously shows that there is a high chance of recurrence. Now in those scenarios, we have to definitely rely on these follow ups. So one of the example which I give to you is about the patient related outcome measures PROMS program. So the entire Indian healthcare industry has to gear up on realizing the importance of PROMS. European countries and US countries, they have leveraged the importance, and the patient also needs to be told about the importance. Sometimes people, I mean, unfortunately, there is a lot of trust about the healthcare system in minds of patient, and they feel that once the treatment is done, any request for a follow up is leading to some sort of a commercial interest, which is actually not
Absolutely.
the case. And it's absolutely not in the space of cancer care, because the clinicians, they really want to know, and there are very strict protocols in cancer care that okay, post 3 months, 6 months, 1 year, then you have scans, you have diagnostics, and if you have a very kind of a robust mechanism to follow up, and the data is being fed up not only of these diagnostic, the planned diagnostic, but also on the daily and the weekly basis. So there are many organizations which are coming into the play. The tech is helping, these wearable devices that you said, but only device will not work. You need entire ecosystem. So you need the tech providers, aggregators, and the hospital and the doctors, and most importantly, the power of analytics. Because if you rely only on manual intervention of such humongous data, then again we are losing, or we are probably getting into that mode where the data will be available, but you will not get that insight at the right time. So these
No,
outcome measures is extremely important, and the patient becomes the important stakeholders.
absolutely. Like you rightly mentioned, I have seen a lot of people who are who have been asked to do annual health checkup, and they will say no, they just want to extract money out of us, and that is why they are asking to do annual health checkup. They don't understand the
No,
importance of, they only want to go to the doctor only when there is something wrong with them.
yes. So again, just quoting one of our senior oncologists, I mean, his favorite statement is, you need to listen to your body. So the moment you find your body is signaling you something, there is something that you need to take care. You go to your clinician. As I mentioned to you, there's a lot of distrust, but I think people need to understand. You can take two opinions, three opinions. I mean, nobody is asking you to take decision just based on one opinion. But
Hmm.
if you've done diagnostic, if you've seen something, uh, Indian healthcare is one of the best equipped healthcare. The doctors are best, the nurses are best, the systems obviously are state of the art. So there is no reason for you to kind of be uh, conscious of such exercises. Uh, Say a disease like cancer, it gives you a window. It gives you a window of opportunity to manage, or rather cure the disease. But for that, you need to listen to your body, and then you need to actually work with the healthcare system and the doctors to help you. So I hope, with the advent of technology which we are talking, including these wearable devices, and development of a very robust screening program, and hopefully in the coming days some of these screenings, or the vaccinations also coming into the play, things will definitely improve in the Indian landscape.
One more question I want to ask you is about non-clinical tasks. You talked about data analytics. You spoke about artificial intelligence. A lot of the technologies that are coming in are also helping in, you say, streamlining the non-clinical work in healthcare system. How do you see that integration happening at a cancer care hospital?
So, see, technology is a great enabler, and like any other industry, it is already helping, but it is bound to actually help or change the entire landscape of the healthcare system. So, any hospital which probably resist getting into this technological race or bandwagon is bound to lose big time, because many people think the investment as an upfront investment, but what they don't realize is the huge advantage that technology can play in many of these the non-clinical work areas. So as simple as that, workforce allocation. Say if you have a very robust data collection and data analytic model, then it can immediately trigger your workforce allocation Your senior staff can be allocated to more serious patients. Your sometimes, say for example, if your wards are little less cumbersome, then you can shift the patient or the workforce to the ICUs out there. If you have a way of projecting the workload using your own historical data, because every hospital, every geography has some lean periods because of
Hmm.
whatever reason. It could be festive season, it could be seasonal, it could be political situations. So again, all these predictions are fed by data. So supply chain management is again huge area. If you have a very strict control, if you have a smarter systems which can give you inventory at hand, if you have a very smart hospital information system which can give you your complete stock uh, at the click of a mouse, then you don't need to keep lot of inventory into the system, because for hospital
Hmm.
everything is money. I mean, why do you want to keep your money in the stock which is less moving? So this is again an example. Then utilizing data, I think the other area, or technology, I would say data and technology, is to reach out to the patients and the community in spreading awareness about the cancer itself is huge area. So we run a very innovative program, probably one of the first hospital in India, where we run a structured program for inviting students into the hospital, and our senior clinicians, doctors and management and nurses, technicians, they all spend time, and in fact it's like a classroom setting programs which we run, where we give them an insight how our hospital work, and then we make them realize the importance of some of these things which we mentioned, like general health screening, something
Hmm.
like blood donation. So I mean, they go back into their own settings, they talk, and they actually force their own adults and parents, grandparents to come to the hospitals and get their annual screening done. And trust me if you can, we have seen in last few years, because of such screenings itself, we have been able to find some early detection of cancers and save lives.
That's wonderful, because even today there are some people who find hospitals very intimidating. They find it, अरे hospital में जाना है मतलब कुछ problem होगा. It's very intimidating for them, the entire setup. So I think this is a very good initiative from your part.
Yeah, I mean, the idea was itself this, that you have to remove fear about hospital. I mean, we as a hospital are we are proud to say, we don't feel like an hospital. The moment you enter into the hospital, you don't smell like an hospital. You smell of a coffee because you enter into a cafeteria. You have a happy place where actually students come and play music and dance for patients. Uh, so it's a different place. It has a psychological difference itself. So by design, for
Absolutely.
example, there is a concept of a patient centricity which we put up even in terms of designing our hospital. So each and every room of the hospital is light facing, because there have been evidence when the patient look at the sunlight, they have a better sort of a psychological mind frame, and the drugs respond in a better way as compared to when you are inside a room which doesn't have an access to sunlight. So these are few examples uh, which we call it as a patient centric approach, which has helped us. I mean, in fact, maybe I would say uh, this has really helped us in being rated as one of the India's highest rated hospital, or one of the Asia's highest rated hospital by patient, which is by Google ratings. And many times the reason for these ratings is not only clinical obviously is most important, but are the other these steps that we have taken, where they feel that uh, this is a different place, their patient is being taken care, small things are being noted down, and we listen. And when we say we listen, we analyze the data. So daily feedbacks are extremely important. There is a daily meeting which is being chaired by the CEO of the organization, and any single feedback given into the organization is fed by or into the system. So now we are in fact going ahead and doing the automation of these daily feedbacks, reading, and the insights which are coming out. So again, an example of how data can help.
Absolutely. That sounds very interesting. Amit, my one last question to you is, a hospital that is starting out in digital transformation, especially a cancer care hospital. There are many paper based hospital, as you rightly said. So, if they shift to digital transformation, if they shift to a paperless system, what should be the three things that they should keep in mind, and what should be the three things on their checklist?
So I think most importantly, when you talk of a digital transformation, they need to understand the data, which is extremely critical. As I said to you, historically there have been a mindset that you get data whatever you can, because paper, it doesn't cost you the time and effort that we're talking in terms of collecting the data. So you just ask the patient to get the entire files. When we are talking of a smarter hospital or a digital hospital, I think we need to be very clear that we need to collect some data points, but what are those data points? Will it help the hospital and the patient? There is no point in collecting bunch of data which ultimately will not lead to the data. So a very clear understanding. So all the doctors and the data processors will need to sit together when they're building up their entire system. They need to work on this data analysis, data compartmentalization, or data classification inventory. The second part, which I think every hospital from this point onwards has to, is to work on the data security and access control, role based access control, uh, which is historically has been a weaker point in the Indian healthcare industry. Because now, when we are talking of a digital organization or a digital hospital, then you carry a risk that anybody can access data if you don't have a robust, secured mechanism. So this again is something that you need to focus on, and you have to be very well aware, or you have to actually work with multiple stakeholders in terms of defining your retention policies, your access policies. And the last but most important is investing in the skill sets of data analytics, because at the end of the day, a data pool or a data lake or a data warehouse sitting into the organization without skill sets to analyze and give insight to the data and analyze and give input to the doctors, then you're just fighting a losing battle. Because then after one point of time, your clinician will ask you, you're after a life of trying to capture the data, but what am I getting out of it? So a
Hmm.
lot of effort and, I would say, resource have to be given. Say, unfortunately, IT has been considered as the cost center in the organization. So I think the industry itself have to get out of that mindset that this is a cost center, because the power of IT and the technology and the data can actually, in the long run, or I am not saying even long run, in a mid to long run, can help you substantial saving, and most importantly, it can save lives.
Absolutely. Thank you. Thank you so much, Amit, for this conversation. I'm very sure whoever is listening to this will have great takeaways from this conversation. Thank you so much.
Thank you. Thank you, Arti.